नमस्ते बेटिया, हमेशा खुश रहो बेटिया। A very good morning to you all. Myself, JVWU Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine in Faculty of Humanitarian Science at JVWU Women's University, Jaipur. In today's clinical lecture, we are going to discuss about the 12 pairs of cranial nerves. Whenever a patient with any neurological disorder is coming to you, how we are going to examine the cranial nerves function. Alright, whether the cranial nerves are functioning properly or not, this we are going to demonstrate today in today's lecture. Alright, so let's start with cranial nerves. What are the cranial nerves? Cranial nerves are the nerves that are arising from the brain and the brain stem, and these are supplying the distant part of the bodies and carrying out the various information from the brain to the distant parts to carry out various functions. The cranial nerves are basically of three types. We have sensory. The cranial nerves are having the function of sensation, that is sensory nerve. We have motor nerves and we have mixed nerves. So sensory nerves are basically the nerves which are carrying the sensation from the body parts to the brain. The different sensations like pain, like heat, like cold, all these sensations are carried from the body part to the brain through the sensory nerves. The motor nerves are used to carry the information from the brain to the muscles to carry out different types of motor activities. And there are certain mixed nerves which perform both the functions, that is carrying the sensations and also giving the motor means guiding the muscles to perform different type of activities. So these are the basic three functions of the cranial nerves. Now let's discuss the cranial nerves one by one. There are 12 pairs of cranial nerves that are present in the brain. Alright, in the brain and the brain stem, there are 12 pairs of cranial nerves that are supplying the body. First of all, let's name them one by one. First of all, I will be naming all those cranial nerves. And then we are going to discuss how to examine those cranial nerves one by one. Alright, so let's start naming these cranial nerves, and then we are going to do the examination. I will be telling you how to do the examination for those cranial nerves. Right? First is olfactory nerve. Olfactory nerve is, as the name suggests, it is having the sensory functions of olfaction. Whatever you are smelling from the surrounding, from the food items, good smell, bad smell, all of that is due to the olfactory nerve. Alright. The next one is the optic nerve. Optic nerve is having the functions of vision. Whatever you see around you, that is due to your optic nerve. Optic nerve is having the functions of vision. It is providing you with the vision during the day, during the night, and also it is responsible for your colors. In absence or in any region in the optic nerve, you can be either blind, you can be night blind, or you can also have the disorders like color blindness. Right. The third one is the oculomotor nerve. Right. Third, fourth, and sixth. These are three pair of nerves that we are going to study together. Basically, second, third, fourth, and sixth, all these, second is basic, second, third, fourth, and sixth, all these four nerves are related to your eye. Second is related to the vision, and third, fourth, and sixth are responsible for the movement of the eyes. Alright? Movement up, down, movement of the eyeballs, movement of the eyelids. So, third, fourth, and sixth, that is oculomotor, trochlear, and abducens. These are the three nerves that are responsible for the eye movement. Alright. So, when we are talking about oculomotor is responsible for the movement of the eye inward, upward, and downward. Alright. Then we have the trochlear. Trochlear is responsible for the downward movement of the eyeball, and abducens is responsible for the lateral movement of the eyeball. Alright. When there is lesion in the trochlear muscle, there is the condition called as squint, and also the nystagmus that is observed. So these were related to the eyes. All these four are related to the eyes. Next, we have the fifth pair of cranial nerve, that is known as the trigeminal nerve. Trigeminal nerve is having three branches. I am not going into detail of all these nerves because this is a very brief session where I am going to tell you about the functioning and how to observe, how to do the clinical examination of the cranial nerves. In detail, you have already studied in your anatomy and physiology. This is just a brief session where I am going to tell you about how to do the examination. This will be a very brief session. I am not going to tell you from where the nerves are originating, from where it is going, and what are the different functions. I am not going into detail of all those things, but I just want to be brief in order to do a quick recap while during the examination, that how are you going to examine the cranial nerves when it is asked in your biologists. So the trigeminal nerve, it is having three divisions. We have three divisions of the trigeminal nerve that we are going to do the examination. Number one is the ophthalmic division. Ophthalmic division, this way we have three divisions of this trigeminal nerve. We have the ophthalmic division supplying the eyes, the scalp and forehead. We have the maxillary division. Maxillary division is supplying the roof of the mouth, the pharynx, the upper teeth, alright, this cheeks, and the lower one is the mandibular. Ophthalmic, we have maxillary, and the third one is the mandibular. So this nerve, that is trigeminal nerve, is having three divisions. One is the ophthalmic, maxillary and mandibular division. Three divisions are there. So ophthalmic division, we are going to check whether the sensation are felt in the eyes, the forehead and the scalp. In the maxillary division, we are going to check for the maxilla, the cheeks, the upper teeth, the roof of the pharynx, the mandibular. In the mandibular, we are going to see for the lower part, the jaw and the cheeks, the floor of the mouth. For this, we are going to check. For the ophthalmic division, we are going to do the corneal reflex, and for the mandibular, we are going to do the jaw reflex. So these are the six pair of cranial nerves. First of all, olfactory, optic, oculomotor, cochlear, trigeminal, and abducens. Olfactory is related to the smell, optic to the vision, oculomotor, that is movement of the eyeballs, medially upward and downward, cochlear for the downward movement of the eyeball, abducen for the lateral movement of the eyeball. Trigeminal nerve, we have three divisions. One is ophthalmic division, maxillary division, and the mandibular division. So this was about the six cranial nerves. Now we will discuss about the next six cranial nerves. I think you have understood somewhat or the examination or the movement that we are going to do. For olfactory nerve, we are going to ask the patient to smell something. First of all, ask the patient to close his eyes. Then you are putting one thing in front of the nose of the patient, anything that you want to smell. Suppose you have taken a bottle, there's something in it, ask the patient to close the eyes, obstruct one nose, and then ask the patient to smell and tell us what is the smell about. So this is the examination of the olfactory nerve. First of all on one side and then on the other side you have to do the examination for checking whether the patient is able to smell properly or not. Alright, so this is the examination of olfactory nerve, how you are going to do the examination. Like this way you have to do the smelling. The second one is the optic nerve. For the optic nerve you have to check for the vision of the patient, whether the patient is able to see or not. There are two things that we are going to see in the optic nerve. One is the visual acuity and the second is the visual field. So in the visual activity we have to see whether the patient is able to read properly or not. So for that we have a smell chart. You all know about the chart, that whenever we go for the eyesight examination, then we have a chart and some alphabets are written on this. First of all in larger characters, then smaller characters, then further smaller characters, and then very small characters. So this is basically a smell chart are checking for the visual acuity, whether the patient is able to read properly or not. So this is the visual acuity test that is done for the optic nerve. The second one is the visual field test. Visual field test is field means how much you are able to see while sitting at a particular place. For this test, you are sitting in front of the patient. Both the physician and the patient have closed their one eye with one hand, and they have put an object. Then they move the object this way, horizontally as well as vertically. And then we are trying to check till what point, without moving the eyeballs, the patient is able to see. If the visual field of the patient is as that of the physician, when the physician is normal, that means the visual field is normal for the patient, and if the visual field is not proper, that means the patient is having certain problems. So this is basically visual field test. So we have completed olfactory nerve test, we have completed optic nerve test. Alright, for which we are checking for visual field and we are checking for the visual acuity. The third is the oculomotor test. So oculomotor test is basically done to check for the movement of the eyeball. As I have discussed, that we are going to check three types of motion in the eyeball. That is, we are asking the patient to move the eyeballs upwards, eyeballs downwards, and eyeballs medially. If the patient is able to do this thing, that means the oculomotor nerve is okay. There are certain muscles that are involved in this. We have superior rectus, inferior rectus, superior oblique muscles, and medial rectus. All these muscles are involved in oculomotor nerve examination. Then we have a trochlear muscle, trochlear nerve. In trochlear nerve, we are just checking for the downward motion of the eyeball, that whether the eye is moving downward or not. Just remember one thing, that during the movement of the eyeball, oculomotor, trochlear and abducent, all these three nerves are working together. We cannot differentiate easily that if one nerve is working, that means other nerve is not working. No. That's why we are studying these three nerves all together. We are studying oculomotor, we are studying trochlear and abducent in a single unit with the movement of the eyeball. Alright. So trochlear is related to the medial movement, downward movement of the eyeball, and abducent is related, sixth nerve is related to the lateral movement of the eyeball. That is, if this nerve is working properly, that means there is the involvement of the lateral rectus muscle, and the patient is able to move the eyeball laterally. When the sixth nerve is not working properly, when there is a lesion in the sixth nerve, then you will find squint in the patient. Squint means the eye will be directed, eyeball will be directed medially. Alright. So you will find in a lot of patients squint. Squint will be due to the damage to the sixth or the abducens nerve. There is another condition where the eyeballs, you will see the oscillatory movement of the eyeballs. So one condition that you will find due to the lesion in the abducens muscle is the squint. Squint is the medial rotation of the eyeball due to the inactivity of the lateral muscles, lateral rectus muscles. And the other second condition that you will find will be nystagmus. Nystagmus is basically what? Nystagmus is the oscillatory movement of the eyeball that is due to the damage to the abducens nerve. Alright. So this is all about oculomotor, trochlear and abducens nerve examination. Now we come to the examination of the trigeminal nerve. What we are doing in the trigeminal nerve examination is, we all know that there are three divisions of the trigeminal nerve. Alright, this way, three divisions. One is the ophthalmic division, axillary division, and the mandibular division. So for the ophthalmic division, as we all know that it supplies the head, the eyes, the forehead, the scalp. Alright. So for checking this, we are doing the corneal reflex test, where a cotton bud is taken. In this way, a pointed cotton is taken and it is touched to the conjunctiva. Alright. And then, cornea. It is touched to the cornea, as it is known as corneal reflex, and there will be involuntary blinking of the other side of the eyelid because of the proper functioning of this ophthalmic nerve. If the ophthalmic nerve is not proper, then the blinking of the other side of the eyelid will not be there. So this is known as the corneal reflex, that is seen in case of examination of the ophthalmic division of trigeminal nerve. So this cranial reflex. Next, for the maxillary division, for checking the maxillary division, we are checking for the roof of the mouth. Alright, we are checking the cheeks. We are taking a cotton bud and just applying it here. We can also apply the cotton bud for checking for the sensory loss in which part of the face, both on the right side as well as on the left side. So maxillary division, we will be checking on the cheeks as well as in the inside of the mouth, the roof of the mouth. For the mandibular nerve root, for doing the examination, we are doing the we are doing the jerk, mandibular jerk, in which what is done is jaw jerk. It is also known as the jaw jerk. We are putting the finger and then tapping. We are asking the patient to open the mouth. Alright. I don't have a patient, so I am not able to put it correctly. But what we are doing is we are taking the temporomandibular joint. We are asking the patient to open the mouth, and then we are tapping it from the outside. There will be an involuntary contraction or closing of the jaw because of the if this mandibular division is working properly, then there will be contraction and the mouth will close. But if there is the lesion in this mandibular division of the trigeminal nerve, then the jaw will not close. So this is about the examination of this fifth cranial nerve of the trigeminal nerve. So we have discussed about the examination of first six cranial nerves. We have discussed about the ophthalmic nerve, olfactory nerve, optic nerve, the trochlear, trigeminal and adducens. These six nerve examination we have discussed. Now we are going to come to the next six cranial nerve examination. I think all these six cranial nerve examinations are clear to you. It will be more clear when we will come to the college and we are going to discuss it in presence of the patient. Okay? Now let's start with the seventh cranial nerve. The seventh cranial nerve, seventh pair of cranial nerve is the facial nerve. Facial nerve is also a mixed nerve and it carries the sensations from the face as well as the sensation from anterior two-thirds of the tongue. Alright. So what we are doing is all the muscles that are functioning, all the different expression of the face that you are making is because of the facial nerve. If you are frowning, if you see wrinkles on the face, it is due to facial nerve. If you laugh, it is due to facial nerve. If you show your cheeks, it is because of the facial nerve. If you make a pout this way, this is due to the facial nerve. So if whatever expressions that you are making on the face is because of the facial nerve, if there is any lesion in the facial nerve, then all these functions will be lost. This could be checked by asking the patient to frown. You ask the patient to move this eyebrows up so that you can see the wrinkles on the face. If the facial nerve is not functioning properly, you won't find any wrinkle. You will ask the patient to clench the teeth. Just press the teeth together. If there is any defect in the facial nerve, the patient is not able to clench the teeth. You will ask the patient to pout this way. Alright. So these are the different tests that could be done while examining the facial nerve. You ask the patient to pout and then press with the fingers. So all these things are used to check for the facial nerve, whether the facial nerve is working properly or not. Alright, so this is all about the facial nerve. And also we are going to check the taste of the patient, the tongue, for the sensory part of the facial nerve. Alright, so this is about the 7 or the facial nerve. 8, we have vestibulocochlear nerve. Vestibulocochlear nerve is basically related to the hearing and balance. Alright, so for the checking the 8th nerve, we are going to check whether the hearing is proper or not. Alright, so we have two tests for checking the vestibulocochlear nerve. Vestibulocochlear nerve is having two functions. One is for the hearing purpose, and the second one is for providing balance to the patient. Alright, so for checking the hearing, we are using an instrument that is known as a tuning fork. This tuning fork is used for checking the functioning of hearing, whether the patient is able to hear properly or not, and to assess whether the bone conduction. We are going to check an important thing. There are two terms that will be used in checking the vestibulocochlear nerve. One is the bone conduction and the other is the air conduction. So we are going to check whether the bone conduction of the vibration using this tuning fork is better or the air conduction is better. So for this purpose, this tuning fork is used, and for that, for checking the vestibulocochlear nerve, we have two tests. One is the Ravi's test, and the second is the Weber's test. So we have two tests. One is the Ravi's test, the other is the Weber's test. What we do in the Ravi's test, suppose this is a tuning fork, right? We are tapping this and first of all putting it in front of the ear of the patient, asking the patient to listen for the vibrations. When the vibrations are stopped, then after stopping, using this way, you put the base of the tuning fork on the mastoid process, and then ask the patient whether you are listening any kind of vibrations or not. If the ear conduction, in case of a middle ear disease, the bone conduction will be better than the air conduction. Alright, so this will tell you what kind of problem a patient is having. So this is basically the Ravi's test. This is done individually, first on right side, then on the left side. You can do it on any side, but you have to do it separately for both the ears. What happens in the Weber's test is, in the Weber's test, you are using this tuning fork, you are tapping this tuning fork and then putting it on the center of the head of the patient. And then you are asking the patient to check that whether in which ear you are feeling more vibrations. So that will tell you that which side of the ear is functioning properly and the other side that is not functioning properly. So this is about the Ravi's test and Weber's test that are used to check for the vestibulocochlear nerve. Now we are going to check for the 9th and 10th nerve altogether. I think 7th and 8th facial and vestibulocochlear nerve examination is clear to you. Now we are doing the examination of the 9th and 10th nerve. 9th is glossopharyngeal and the 10th is the vagus nerve. Alright, so in the glossopharyngeal and the vagus nerve, what we are doing is we are checking for the inside of the mouth. We are checking for a few important things, like in the checking of the glossopharyngeal nerve reflex. We are giving the patient to drink water, and we are checking if there is some kind of reflux, if there is any kind of regurgitation, nasal regurgitation. When a patient is taking something, when a patient is taking food, if there is any kind of regurgitation through the nasopharynx, then that means this glossopharyngeal nerve is not functioning properly. So we are checking for the nasopharyngeal regurgitation in case of glossopharyngeal nerve, and for the vagus. In the vagus nerve, if the patient is having nasal voice, if there is any lesion in the vagus nerve, then the patient will be having nasal voice, and there will also be stridor. Stridor means voice during breathing. So if there is any lesion in the vagus nerve, there will be nasal voice and there will be stridor. So this is the test that we are doing together. Usually glossopharyngeal and vagus nerve test is done all together. Alright. Now we come to the 11th and 12th nerve examination. So 11th nerve is basically the accessory nerve. There are two muscles that are usually affected by this accessory nerve. One is the trapezius muscle. This is the trapezius muscles, and the second one is the sternocleidomastoid muscles. So there are two muscles that are affected. So for checking the functioning of the accessory muscles, what usually accessory muscles nerve does with these two muscles is it allows the patient to move the shoulders upwards and downwards, usually upwards with the trapezius muscle, and sternocleidomastoid muscle is usually used for doing the movement of the neck. So for checking the functioning of this trapezius muscle, you are pushing the shoulders, you are putting pressure on the shoulders and asking the patient to move the shoulders up. In case of lesion in the trapezius muscle, the patient is not able to lift the shoulders against pressure. And in case of sternocleidomastoid, if you are applying pressure and asking the patient to move the neck on one side, the patient is not able to move the neck on one side or the other side. So this is the sternocleidomastoid muscle. So in this way, you are checking the you are doing the examination for the accessory nerve function. Now we come to the last nerve, that is the hypoglossal nerve. Hypoglossal nerve is basically related to the tongue. This. So what you are doing in the hypoglossal nerve examination is you are checking for the movement of the tongue. Whether the tongue is able, you are able to do the movement of the tongue properly or not. You have to protrude the tongue. You have to ask the patient to protrude the tongue this way. So if the tongue is coming straight and it is not deviated at either side, that means the nerve is proper. You have to conduct some more tests. You have to ask the patient to move the tongue side by side. This way. You have to ask the patient to lick the cheeks from the inside, this way. And you should apply the pressure from the outside or on the other side. So in this way you have to check for the hypoglossal nerve. Also, you have to ask the patient to rapidly move out and in the cheek, this way, in order to check for the functioning of the hypoglossal nerve. So in this way, the examination of the 12 cranial nerves are over. We have discussed how to do the examination of all the 12 pair of cranial nerves. This was a little bit faster, but I didn't want to make it much lengthier because it would become very difficult for you to watch everything. I have just kept the things precise. I have missed many things, but I just wanted to give you a brief recap or a brief review of the different tests that we are doing for the cranial nerve examination, so that you can answer properly for your Viva Voice examination. Alright, so this was all about the cranial nerve examination. This would be done in more details when we are coming for the live sessions in your live classrooms and in front of the patient. So this was basically a brief review about all the 12 cranial nerves. I hope you have understood this thing. So this was all for today. Thank you very much. We are going to meet in the next